A woman is scrolling on Instagram right now. She's looking at before and after photos, tiny waist, fuller hips, and then there's perfect lighting. Behind that picture, though, is a surgery with one of the highest mortality rates in cosmetic procedures. Let's talk about what a BBL really is, not the Instagram version, the version behind the looks. First, fat is removed from areas like the abdomen or back through liposuction. Now that fat is then processed and purified. It is then re-injected into the buttocks to increase volume and shape. Now there are layers to consider: the skin, subcutaneous fat, muscle, and then beneath the muscle are large blood vessels. Now the danger is not the fat itself, the danger is where the fat is placed. So if the fat enters large blood vessels, it can't travel to the lungs. That's where the life-threatening complication happens. If it carries this much risk, why is it still so popular, you may ask? Well, body trends are shifting over time. The hourglass silhouette becoming dominant. Post-pregnancy body changes also becoming a reason why women want to sculpt their body. And social media filters normalizing exaggerated proportions. I know that wanting to feel confident is human, but remember that surgery is permanent. The most serious risk is where fat blocks blood flow in the lungs. Other risks include infection, bleeding, a funny body shape from the surgery, fat death, need for a repeat surgery, and another risk really. The fat survival rate improves significantly when the fat is injected only into the superficial layer and not the muscle. So many people focus on results and not recovery. Now, actual recovery feels a lot different from the results you see. Let's look at some of the things that happen during recovery. One of the things that happens in recovery is you not being able to sit normally for weeks, like for weeks, literally. Another part of recovery is you wearing compression garments. Also, the swelling distorting results for months, plus the pain is very real, my dear. And the final results do take time. There are situations where surgery carries even higher risk. For instance, if you have certain underlying health conditions, again, if you smoke, if you have unrealistic expectations, an extremely high or low body mass index, which is a measure of body fat based on height and weight. In very simple terms, BMI answers this question: is my weight too small, okay, or too much for how tall I am? But it is more of a screening tool than a diagnosis. Also, you should take into consideration your psychological readiness as well as your financial capabilities. BBL has been reported to cost between 1.5 to 22.5 million naira, depending on what part of the world the procedure is done and the type of hospital where it's carried out. BBL is not evil. It is not magic. It is surgery. That's just plain reality. It is surgery. If you are considering it, ask where the fat will be injected. Ask about complication rates. Confirm surgical facility accreditation. And ensure access to emergency care. Confidence is beautiful, but informed decisions are more powerful. Bangi says, be aware, stay sharp, stay healthy.